Well, greetings this morning. This is Dr. Bill Wyatt with the American Orthodontic Society, and I want to discover and explain some things about follicular movement of teeth. We have several videos showing where we took extremely crowded cases and took one tooth out, got rid of the follicle on it, and let the follicle on the other tooth, as it gets bigger and moves over, it'll move the tooth where you can handle it in a lot of these cases. Well, that's just one of the movements of follicular cysts. That's a follicular, what we call this sac is around the crown of a tooth is the follicle. And for some reason or another, in some of these follicles, they go crazy. I don't know what causes it exactly, but the follicle will continue to grow. Fluid can go into it, but it can't come out. And so the follicle gets bigger and bigger and pushes through bone structure at will. It changes the bone structure as it gets close to it, and it also, the follicle will eat away the roots of deciduous teeth or baby teeth. It'll just eat the roots right out from under them. I'll show you some cases of that also. And it will take the crown of the tooth. It can't handle the enamel crown of a deciduous or baby tooth, but it'll just eat the inside of the crown out, and if you leave the tooth alone, you can take it out and just be a shell with the enamel on top of the tooth is not affected by the follicular cysts. And then I want to show some seriously moved teeth here first with this video, and where this young lady had a cyst inside of her jaw. It's quite big. I'm going to get into it and show that to you right away here now. I think we've got it coming. This is the young lady that had a cyst, and it covers an area. Let me get this where I can draw with it. It will cover an area inside of her jaw, just a big area like that. Now, I can show that to you on X-ray in just a minute, and then I'll show it to you after it was peeled out of there by an oral surgeon. And that's, you don't recognize it just looking straight at the young lady. The jaw structure seems to be pretty much the same, but it's not. On one side, this jaw has a huge cyst in it, and then we can show it from here, and you won't see it much forming in here, but I think it started from something on this side of the deal that triggered this cyst to start growing. And there was something wrong with this tooth. I guess this is what kicked the thing off and started it to grow. Well, the cyst will cover a whole area in here like that. In other words, it just keeps getting larger, and it'll take a whole permanent tooth and move it. It doesn't, the cysts don't eat up the roots of the permanent teeth like they do the baby teeth. They'll just completely absorb the root structure of the deciduous tooth, but it doesn't have any power against the enamel of the baby tooth. Now we just show the side of the face and everything, and then this is the side where the cyst is, this area coming down in here. Now you can see it plainer from this side. And what I want to show in here, this cyst even here in America, where they could be seen. If you x-rayed it, you would pick it up immediately. This is the wall of that cyst coming around like that. Now this is a second molar. This is a 6-year molar. It has taken this molar tooth and jammed it up into this corner right here. Now, when the old surgeon went to take it out, he peeled that cyst out, and if I'm not mistaken, he took this tooth out right in here. Now, I will show another video later on showing if you leave it alone and you open a hole in this cyst that takes the pressure off, this cyst will shrink down to nothing, and this tooth will move back into position, for it has a follicle on it that can move that tooth. When you push it up in there, it'll assume a circle. It'll push this crown back out like that. But if I remember this case correctly, they took this out, and then he took that tooth out or got rid of it. Now they'll show you what went on surgically, and this is what we call the quick way of dealing with a cyst, but it is not the best way to deal with it. So here we'll show this cyst is in this area, and it shoved this molar back in here. Now it's kind of like, see, here's the normal. This is a 6-year molar, the 12-year molar, the 6-year molar. Here's this 12-year molar, and here this cyst is in this area down here. Now, the old surgeon, somewhere or another, I've got pictures of this. He had put a syringe into that cyst and aspirated it out. This is not blood, it's got some blood in it, but this is the liquid that's inside this follicle around this crown of this tooth that's pushed up underneath there like that. Now, the old surgeon laid a flap back here, just took the tissue back and put it down here. Then he went in and cut the top off of the cyst, the top of the area where the cyst was. Now this is kind of a bloody, gory looking thing, but here we go. Now he goes in here and cuts that out, and he'll take this whole thing out of this person's mouth. Now he has, you can see where he cut the bone up here, and he took that cyst out, and I think the cyst involved that tooth that was pushed out of place. And I think that it came about from something they worked with a tooth there, and that may have kicked the cyst off in another area, but the cyst grew in there. And so he came back, he peeled this cyst out. He just peeled it out. This is epithelial tissue, and he sent it to the lab. See that it wasn't cancerous or anything, and they sent back that it was epithelial tissue. And this is the inside of that cyst, and fluid could come into it but couldn't get out of it, and so it grew. And the lab sent some pictures back where they took part of that wall of that cyst, and this is epithelial tissue. Fluid can come in it, but it can't come out of it. And so the thing grows, and as it continues to grow, it pushes the teeth out of the way and gets it way out of position. Now, I've talked to you about what I saw while I was in Africa. There are places there where cysts grew and just nobody paid any attention, or they didn't know what to do with it. And the hospital up in Obomoshaw, Nigeria, sent a patient in to me that had the whole lower jaw was the inside of a cyst. And they had opened it and started and left some iodoform gauze in it. And these patients came to me from the hospital in Obomoshaw, and he came down, and this guy spoke some language that none of the boys that worked in the office could understand, and I certainly couldn't understand it. But I shined a light in this. I opened this hole. It was about as big as the end of my finger, and it was clear. And I had a little flashlight just on the tip, and I shined it up in this hole in this guy's jaw. Now this guy looked like he was just had a massive jaw. His jaw was as big around as my wrist here. Just coming around this way, it looked like a massive jaw. But it was just a shell of the lower jaw. And the teeth were hanging down in that shell, just like these stalactites and things in a cave. And I shined in there and I saw that, and I just really wanted to treat this case and see how we could get it done. And I had a lot of iodoform gauze, and I was going to pack it pull it out, keep the opening there, take the pressure off. The cyst would shrink up like this, and then those teeth would, I think the blood vessels to the teeth were still there and everything. They were just hanging down inside of this cyst. I would just love to have treated that young man, but he didn't know what we were saying, and I didn't know what he was saying. And these boys that work for me, some of them speak 2 or 3 of those languages over in Nigeria, but nobody could understand him. And so we were getting ready to go in and put iodoform gauze on this, and the guy got afraid or something that we were doing something to him, and so he left and never came back again. And I just regretted not having the opportunity to treat a cyst that actually involved the whole lower jaw of a man. Well, I went through, and I moved out to Enugu later on in my time in Africa. We were there 3 solid years, and I went to Enugu, and a policeman came in to me, and he had a cyst as big as a small pin egg. It was about this big. It pulls down on his jaw down here. And so in that man, we drilled a hole in this cyst and then drained the liquid out, and we packed it with iodoform gauze, and I kept getting the guy back every week or so, and we'd pull it out and put some more in, and the cyst just shrunk up to nothing, and the teeth went back into their normal position with that. And so I learned something about it. We call that's a slow method of treating a cyst. Is much better than the surgeon has to. He goes and feels like he's got to do this whole job at one time, and he goes and takes the thing out. And so that's not the way. If you get a cyst and you're a dentist and you're dealing with it, go the slow way. You open it, pack this gauze in to keep the opening going, free it up, otherwise it may close over again and continue swelling out and growing. So anyway, I'm telling you that so that you would know that. Now we took that cyst that was as big as a headache. I didn't have any cameras to take pictures of these things, and that really upsets me. I couldn't show that to people, but I can tell you about it. Well, this cyst on that policeman, it shrunk up and it just finally went away, and we were able to take the tooth maybe that had the cyst, do something with it to keep it from swelling out like that. And anyway, that's the way we dealt with those cysts. Now I'm going to end this video, and this is the one that did the fast way, but I do not think this is the best way to deal with a cyst. In fact, I know it isn't. If I had one, I'd want to come away. And we're going to show you another one now where the cyst was moved, tooth way out of position, and the tooth came back. And I got a picture of it when it was here, when it went up here, and when it came back. And that's the way we should do or deal with cysts. So I'm going to close out here and say thank you for watching, and watch this next video we're going to show where the cyst was pushed the cuspid way out of place. We opened it, kept it open, and the cyst, they went away and the tooth came back down where it was supposed to be. Thank you for watching, and I'm going to go ahead and close out and say goodbye, and we'll hope you'll watch some of the other deals.